Welcome to Module 3.7, where we'll examine non-experimental research designs in healthcare. While experimental and quasi-experimental approaches focus on establishing causality, non-experimental designs serve different but equally important functions in healthcare research. In this module, we'll provide an overview of observational studies and explore two common approaches: cross-sectional and case control studies. Observational studies are characterized by the absence of any manipulation of variables by the researcher. Instead, these designs study phenomena as they naturally occur in real-world settings. They're essential when experimental designs aren't possible due to ethical, practical, or logistical constraints, such as studying harmful exposures or rare diseases. Observational approaches are ideal for describing relationships between variables in complex healthcare contexts and establishing preliminary evidence that may later justify experimental investigation. While they typically provide less definitive evidence of causality than experimental designs, well-designed observational studies offer valuable insights into health conditions, risk factors, and outcomes as they manifest in actual patient populations. Cross-sectional studies collect data at a single point in time, providing a snapshot of a population. They are particularly valuable for estimating the prevalence of health conditions or behaviors in specific populations. These designs can identify associations between variables, such as the relationship between risk factors and health outcomes, though they cannot establish which came first. Cross-sectional studies are relatively quick and economical compared to longitudinal designs, making them efficient for initial exploration of research questions. Their primary limitation is the inability to establish temporal sequence, making causal inferences tentative at best. Despite this limitation, cross-sectional research provides essential descriptive data that informs healthcare planning, resource allocation, and hypothesis generation for further research. Case control studies begin with the outcome of interest and work backward to identify potential exposures or risk factors. Researchers select participants who have the outcome, cases, and compare them with those who don't, controls, examining differences in previous exposures. This approach is particularly efficient for studying rare outcomes, requiring far fewer participants than prospective designs. However, case control studies are susceptible to recall bias, as participants' memories of past exposures may be influenced by their current health status. Results are typically expressed as odds ratios, indicating the relative odds of exposure among cases compared to controls. Despite challenges in selecting appropriate control groups and addressing potential biases, case control studies have been instrumental in identifying risk factors for numerous health conditions,